Okay, so we're here at St. Paul Chiropractic and Natural Medicine Center, and I have the pleasure to be sitting here with Scott. Scott lives in St. Paul, Minnesota, close to the clinic here, and he's been kind enough today to provide us a testimony regarding his experience here in the office. And so, Scott, thanks for being here.
Welcome.
And why don't you just tell us a little bit about what originally brought you into the office?
Well, I was having some trouble, pain in my shoulder, arm, losing strength in my bicep and my shoulder, my arm just feeling generally clumsy and heavy. And, I've already had a neck fusion, and I didn't want to have another neck fusion. I felt like the first one, it was only 2 years ago. It was too soon, so I decided I really needed to try and figure out how to minimize the pain and try and get me back on track and try everything before I absolutely had to have the surgery. So I visited a few chiropractor offices and found myself at St. Paul Chiropractic, and Dr. Chris seemed to have just a great program. It wasn't okay, I'm going to adjust you and I'm going to fix you. Let's decompress. Let's do some adjustments. Let's do some electric therapy. And exercises at home, very important to, and taking some supplements as well to help the joints and extra minerals. So with all of that whole program, I felt very comfortable about trying this aspect before I had to have a surgery. I was also doing a parallel program with a surgeon to diagnose what was happening. And at first it was recommended I probably would need a surgery after the MRIs. And so...
You had a nerve conduction velocity test as well, correct?
And I also did well too, and they found that was, I was going to have surgery to relieve that pressure or that, off those nerves so my motor skills would work again. The first fusion did work in that respect. So,
yeah.
So I was, contemplating, but I really wanted to try some other things first. Going through the first surgery and having this discectomy and fusion in my vertebrae, I didn't want to go through all that again. The recovery time's really long. I wanted to live life and see if I could extend this out a little bit further.
Yeah. And so, and then after, we went through a series. I don't think we were even quite at the end of your first phase of the care program. You went back and saw the neurologist again.
I saw the the neurosurgeon, and he, as I described what was happening, I was getting strength, a little bit of strength back in my bicep. The pain was all but subsided. So in discussion with him, we decided it was best to avoid the immediate surgery and see how this progressed out. So I was able to avoid that, and now after 4 months into it, I'm feeling really comfortable with not having to have the surgery in the near future. So
awesome. And so any advice for, you think, that anybody here that might be watching this video and kind of on the fence as far as kind of what to do or what not to do, maybe considering to start a program of care similar to like ours here, what would you tell them?
Well, I would say, it's you have to give it a try, and look at, like, I looked at chiropractor offices and I found this one to be the most complete as a program to really try and help.
Well, I can't thank you very much for your testimony today, and hopefully this will go out and help some people make a decision.
Yeah, I hope so. It's
Awesome.
worth a try.
Thanks, brother.